Administration of suppository is a skill station newly added to the NMC OSCE in November 2022. This might be one of the 4 skill stations you might be asked to perform on the day of the OSCE examination. This skill station is explained as follows. You will perform this station on a mannequin and the examiner will give a voiceover to answer the candidate's questions. The allowed time for the station is 10 minutes. This station can be classified into 4 phases, which are: Introduction phase, Pre-procedural phase, Procedural phase, Post-procedural phase. Introduction phase. In the introduction phase, you will need to perform all of the listed below. 1. Checking for scene safety. 2. Close the curtain or door to ensure privacy. 3. Hand hygiene. 4. Introducing yourself to the patient by saying your name and adding that you are going to look after them today. 5. Confirm the patient's identity. Ask for their name and date of birth and hospital number, but you can also confirm this by checking against their wristband. 6. It is advisable to know about the patient's allergy in the introduction phase. 7. Explain the procedure to the patient and gain consent. Also, tell them that you have a bedpan or a commode ready for them to use after the procedure if needed. Ensure privacy and dignity throughout the procedure. Pre-procedural phase. Clean your hand with hand rub, or you can also use soap and water to maintain hand hygiene. Dry your hands with a paper towel. The paper towel is to be discarded in the general waste bin. Perform hand hygiene during all 5 moments following all 7 steps recommended by WHO. Try to verbalize the steps of hand hygiene once during the procedure and demonstrate them appropriately. Wear a disposable apron and put on clean gloves. Make the patient ready for the procedure by assisting them in maintaining the required position. You can verbalize the position to the examiner saying that you will make the patient lie to their left lateral side, keeping the knees flexed, raising the feet level and the buttocks near to the side of the bed. In the OSCE exam scenario, do not attempt to move the mannequin for health and safety guidelines. Prescription check. Check whether the prescription is valid by confirming right drug, right medication, right time, right route, and right dose. Essentially, also check the patient's allergy, doctor's name, signature and registration number, validity and legibility of prescription. ID check. Before the procedure, check the patient's identity again. Procedural phase. Before proceeding with the suppository insertion, verbalize to the examiner that you will observe the rectal area for any signs of infection, swelling, hemorrhoids, redness, tenderness, and rectal prolapse. Take a piece of gauze piece and apply some lubricating jelly to it. Lubricate the suppository for easy insertion into the anal passage. Separate the buttock muscles and advance suppository into 2 to 4 centimeters using the correct end. The same process needs to be repeated if there is more than 1 suppository is prescribed. After insertion, clean the perineal and perianal area with a gauze piece as there might be excess lubricating jelly. Tell the patient to lie down for 20 minutes or more if they are able to. Verbalize to the patient that the suppository melts and comes out of the rectum, which is normal. Also, provide a comfortable position and help the patient to the toilet or assist with the commode and bedpan as needed. Maintain privacy and dignity by dressing up the patient properly after the suppository insertion and usage of curtains at all times. Post-procedural phase. Waste disposal and cleaning, discarding the waste appropriately following the waste management policy. Cleaning the equipment used, preferably with Clinol wipes. Hand hygiene, clean hands with hand rub or soap and water as required. Documentation, document the administration and any findings or comments if any. Check date, name and signature before finishing the station. Reassurance, reassure that the patient is comfortable and place the call bell within reach before you leave the patient's side.
For more OSCE videos, follow NurseFacts.